Welcome everyone to this rapid response webinar on COVID-19 and the criminal justice system. Our topic today is recovery planning for COVID-19 releases. Before we begin, I just want to say the ABA is working hard to push critical information out about various topics and successes in different jurisdictions so that we as a profession can help each other get through this crisis. That's what these rapid response webinars are all about. These webinars are brought to you by the ABA section on civil rights and social justice, the ABA Standing Committee on Legal Aid and Indigent Defendants, and the ABA Criminal Justice section. We are actively planning additional rapid response webinars, so please check back at americanbar.org/CRSJ. Before we move on to substance, I just want to go over some technical aspects of the webinar. Participants, you can all not be seen, so don't worry that you're on camera. And we encourage you to ask questions. To do that, what we're going to ask you to do is if you highlight at the bottom of your screen, you should either see questions and answers, Q&A, or if you click on more, you will find the question and answer box. Please open that box. That is the correct place to put questions. Please do not use the chat function because that is just harder for us to manage. So the Q&A box for questions. On the webinar website, there are materials on this webinar, and we will be trying to add and update these materials even after this webinar is closed. Additionally, every registrant will receive an email link back to the webinar page once the video for this webinar is all ready. We are recording this so that people can watch it even who were not able to make the live event. Please share that page widely within your networks if you found it useful. Finally, I have to say that this webinar is not possible without members of the ABA. They literally make it possible for us to bring these things to you. So if you are already a member, thank you. And if you are not a member, please consider joining. The ABA recently reduced its membership rate substantially for public interest lawyers. I know this is a difficult time, but if you are able to join, please get active. SCLADE in particular and CRSJ would love to have you. Okay, so substance. This webinar actually comes from a series of questions that we were getting in other webinars about reentry planning for those being released. We've had webinars on different aspects of release from low-level offenders and pretrial, expanding pretrial releases to also compassionate release for older and at-risk prisoners. And in each of those, people have asked us what reentry planning is being done. Across the country, advocates are seeking and obtaining release. The speed of these releases in particular raises concerns about whether these individuals are prepared, particularly given the COVID-related restrictions that exist in most jurisdictions and that they face when they're released. Releases necessary to create healthier conditions in prisons and jails may create additional public health issues if people released lack access to housing, food, medical care, and other supports, particularly if they cannot self-isolate or quarantine. What do released individuals know about the pandemic and the resulting stay-at-home orders? And how are they supposed to be able to provide for their basic needs, no less begin to rebuild their lives in the present economic and health conditions? Each of our panelists is on the front lines trying to help individuals successfully re-enter society, and each has seen their work change fairly dramatically with COVID-19. Today we're going to be talking to Rebekah Almanzar, who is a social work supervisor with the Legal Aid Society of New York. Stacy Borden, who is a founder of, I'm sorry, Stacy, I blew this and didn't have your thing in front of me.
New Beginnings. I'm a licensed clinician with New Beginnings Reentry Services.
Thank you so much, and I apologize for that.
No worries.
I did it. Wendy Peterson, who's the Assistant County Administrator for Pima County, Arizona, that's Tucson. And with her is Kate Beasley, who is the Director of Justice Reform Initiatives for the Criminal Justice Reform Unit in Pima County. I'm going to start off with some introduction introductory questions that'll allow our panelists to talk generally about their work. And I'd like to begin with Kate and Wendy, and you all can figure out who goes first. Before we kind of turn it over to you, I want to say Pima County was already in the process of reducing its jail population before COVID-19. As described in a previous webinar, we were told the jail population was down from over 2,000 to just about 1,500. So you'd already reduced by more than 25% before the pandemic. COVID-19, I think, has accelerated those efforts. How are you planning for the release of individuals? What have you been able to offer people who very quickly and perhaps unexpectedly are being released into some very unusual circumstances?
Sure. Well, this is, I'm Wendy Peterson. I'm the Assistant County Administrator for Justice and Law Enforcement in Pima County, which is Tucson, Arizona. And I think you might know that our county is a very large county, probably as big as maybe Massachusetts. It's very rural in many respects and has encompasses 2 tribal nations. So in 2016, we applied for and received a very generous MacArthur grant from their Safety and Justice Challenge, whose goal is to safely reduce our jail population and to try to ask Americans how to rethink how they think about jails, especially through a racial and ethnic disparity and disproportionality lens. So with that in mind, we've had 2 very generous MacArthur grants. We're probably going to apply for a 3rd cycle of grants, but we had sort of a baseline foundation, as you mentioned. Our jail population was creeping up towards its capacity, which was between 2,200 and 2,300, when the county was faced with either build a new jail, which you don't want to do, or find creative ways to safely reduce the jail population. So we've been working on this for 4 years. And I would say up until, in fact, I looked at this yesterday, a month ago, our jail population was right around 1,950. And we were extremely frustrated because we had just flattened out and nothing we were doing seemed to really change things. So we were looking for ways to radically change our strategies with MacArthur so that we could safely reduce this, population. As of yesterday, our population is now down to 1,583. How that happened in a month is a very good story. So as I mentioned before, we had a pretty good foundation. We have a very robust Justice Coordinating Council that meets on a quarterly basis. We've got very good communication between our jail, our prosecutors, our public defenders, our county administrator, who is an absolute visionary in terms of looking at criminal justice reform. In fact, Kate and I are both members of the Criminal Justice Reform Unit that was created within the county administrator's office. In any event, so we had this terrific, in my opinion, terrific communication. We meet on a regular basis, trying to figure out ways to reduce the jail population. And about a month ago, really before COVID was really rearing its ugly head, we saw a newspaper article from another county in Arizona that released 50 prisoners or 50 inmates. And they were low level, either low drug level or maybe drug possession or maybe shoplifting, trespass, that kind of thing. But 50 people were released. So I called the person in that county who was in charge of this, and I said, so what did you do? Do you have transportation in place? Do you have housing in place? What are you doing about keeping in touch with these inmates? And the response was pretty remarkable, because they said, we let them out. We got a court order, we let them out. And we decided here in Pima County that we couldn't let this happen. And we needed to make sure that those folks who would be released had safe and secure and stable housing, transportation, et cetera, et cetera. In the meantime, our sheriff, Mark Napier, issued a memo to all of the criminal justice agencies across our county with 7 suggestions on how to safely reduce the jail population in light of the COVID pandemic. So we took this and we started a conversation with all of our safety and justice stakeholders, started a phone conversation because of course by that time everybody was being isolated. At the same time, Kate, my director here, received a request from Amelia Kramer, who is our Chief Deputy County Attorney and who was on last week's webinar, to work with our public defenders and our other agencies, probation, et cetera, to come up with a plan to try to take care of those inmates who were going to be released. And at that time, we thought we had about 200, right, Kate?
Yes, that was our initial estimate.
Yeah, so we were very concerned about this. We just didn't want people to go out into the community without some safeguards. So at that point, Kate got involved and really tethered together a lot of agencies that we were already working with primarily. And through some of our other initiatives and through MacArthur, we had already established relationships with housing folks. We have a Housing First program here in Pima County. So we had a lot of the infrastructure already in place. At this point, I'll ask Kate to describe what she's done from, and that was what, May 3rd or March 3rd?
Yeah, that sounds about right. Seems like it was months ago now, but it was only a couple weeks ago. And it's really been all hands on deck here in Pima County. As Wendy said, we've really been able to benefit from existing lines of communication. Our county attorneys and public defender's office were working cooperatively to identify an appropriate population that was safe for release from the community. And it's because they had those lines of communication. We were able to receive communication on a regular basis about, we've been calling them surge releases, where they would do essentially a stipulation or a bulk hearing depending on whether somebody had a victim in their case or not. And so we were able to scramble very quickly with all these existing partnerships. The public defender offered up a social worker that they had. The pretrial services department had an individual identified, adult probation had an individual identified, and we were able to cooperatively work among all these agencies to sort out who would be coordinating housing for each of these individuals who are going to be coming out. Our main priority is that we weren't going to be putting anybody into shelter housing. We felt like in light of the COVID-19 pandemic that it would be irresponsible to start placing people where there was a lot of other people. So when we reached out to our housing community, one of the first things that we would ask about is, what is your pandemic plan? Many of them have isolation rooms already set up. Many of them are already housing based as opposed to large dormitory type arrangements. They actually have 2 or 3 individuals in a bedroom in a house somewhere in the community. And so knowing that we were able to spread people out, that we were putting them someplace where they were able to socially isolate was really helpful. In addition to that, there's all those logistics that go in behind the scenes. Okay, well, now we have housing. How are we going to pay for it? And again, as Wendy mentioned, that we are a MacArthur Safety and Justice Challenge recipient, and this wouldn't have been possible without MacArthur. They've been really responsive to COVID as well, and so we were able to redirect some funding that we had set aside for a separate committee where we're trying to get people out of custody as fast as possible, and we redirected that into our COVID-19 releases. And so we were able to identify a payment mechanism. The jail stepped up to the plate and said, we will assist with transportation. And then we had a network of housing and shelter providers meeting every single day at 10 a.m. And so it's a Zoom call among people in Tucson who are able to give live updates on not only what beds they have available and what measures are putting in place to combat the COVID, but then also bringing in medical providers, MAT providers, that's medication assisted treatment, and be able to update the community on what we were doing as far as housing releases, jails release, and then being able to prepare them for what we were seeing. And then everybody who was already at the table said, what can we be doing to help? So we had a lot of support from our detox providers, community treatment providers, who we were sending the list of names out. They were identifying their participants among those lists and then reaching out to their clients to say, what can we be doing to assist you in this time? So it really has been a huge community effort from not only our governmental entities, but also our treatment providers, housing providers, everywhere in the community.
That's really amazing. Before we move on, I think I heard you mention at least two groups of people that are getting together regularly to discuss, right? You have kind of this jail release group that involves the county attorney's office, the public defender's office, the sheriff, and then you mentioned a housing group that's getting together to talk about placements. What other, I mean, is that it, or are there other critical group calls that you've assembled of kind of the key people that need to be talking regularly during this crisis to coordinate successful release?
Well, I can tell you from my perspective, the county administrator is issuing a document on a daily basis for, you know, what's going on from the aspect of, you know, what are news agencies looking for? What are people in the community concerned about? What questions are they asking? And yesterday I went on and looked at it, and included in there was a briefing from the sheriff's department. So as an example, you know, the sheriff is and I would imagine our other police agencies are doing the same thing, but I happen to see the one from the sheriff where on a daily basis, they're talking about what their officers are doing in terms of people that they run into who are COVID positive. They talk about they're releasing the inmates, they're taking temperatures, they're isolating people when they need to. So there's a lot of that kind of communication. That's not a phone call, but that's a daily communication involving our sheriff, our county administrator. We've got our county medical officer weighs in on a daily basis. We have a video that all Pima County employees can watch where our health director, Dr. Bob England, talks every day about how to best take care of yourselves, you know, the usual sort of things about washing your hands, et cetera, but also giving statistics on what's going on with people who are in the community who are afflicted by the virus. So we've got a lot of communication that's going on either by daily telephone calls, as Kate is saying, by these briefings from our county administrator and the sheriff. We also have we've changed to a weekly Justice Coordinating Council meeting, and we're going to have that this afternoon by 3 o'clock, which will give an update on more of the county inmate releases. Kate, I'm trying to remember, how many have been released so far?
We've got between about 50 or so who've been released in two different batches. One was for individuals who did not have a victim in their case, and others who did have a victim. And again, these are low-level, non-violent, non-dangerous individuals, primarily substance use, but we also have some property crimes as well where the victim does not oppose their release. And Wendy, another thing I recall is just the last couple of days, our Pima County one-stop program, which is the one-stop for housing, but also wraparound resources in the community. They are trying to mobilize the community as well for housing, or excuse me, for employment resources and being able to connect individuals who are looking for work with those services who are in the community and those employers who are looking to hire.
Thank you guys very much. So you are kind of a model of how to take an existing cooperative relationship and turn it on a dime and focus on a crisis. I want to let Rebekah talk next because I don't think New York was quite that organized or quite that cooperative. And she's dealing with reentry planning under very different circumstances. So Rebekah, why don't you tell us a little bit about what's going on in New York and what you're able to do for people getting out of Rikers?
Sure, thank you. So just to understand a little bit of the perspective that I come from, I am a social work supervisor for social workers who work with individuals in 2 units in our public defender's office, which fall under the parole revocation defense unit. So any individual who's been held at Rikers Island, the large jail complex in New York City, before the decision in their parole violation matter has been decided. So a large amount of all of our clients are held there until they are released, even though they're technically still under state custody. And then the other group of clients that the social workers I supervise work with are individuals who are in prisons in upstate New York. So really different procedures. We have release from a local jail in its essence, and then we have release from state facilities, state prisons. So different in terms of the kinds of the medical services that are available, the kind of discharge planning that is available within the jail and the prison, as well as the needs of the people coming out. You have individuals who've been in prison for a very long time and are kind of coming back to New York City in a whole brand new environment many times. So I think maybe I'll focus first on New York City jails, on Rikers Island releases, because where most of the news has really come out of, and understanding kind of what the situation is there, and then can kind of also give information about what we do know from prison releases at this point. So our individuals at Rikers, like I said, are, and that doesn't represent the total population of people, obviously, that we work with as social workers in legal aid, but focusing on the people that I know about releases. So they're in usually very specific facilities, because Rikers Island was an 11 jail complex and has been, the city was working to reduce the population prior to COVID, but all of our clients are there. And as the increase in positives was happening in New York City, we all knew and anticipated it was just a matter of time, mainly before maybe a corrections officer or a civilian really brought it into the facilities, and it started. And we have a really excellent correctional health services within New York, within the Rikers Island jail complex, that already anticipated really how much worse this was going to be than maybe what was happening in New York City as a whole. And we're very vocal from the beginning. We need to release people as soon as possible, because what we have, we're going to do our best, but this is going to be very terrible for the people that are here, corrections officers, people who are incarcerated, and the healthcare providers included. And we've already started to see that. It didn't take very long before exponentially the numbers have been going up. So there have been responses, and a lot of what we as social workers in our unit have been doing is about pulling from the resources that are already there. New York is very wealthy in terms of its resources for people. We have a lot of people, but we do have a lot of resources. So it was first about information gathering. How are people deciding to change, and at what rate are they deciding to change substance use services, mental health services? And really the biggest issue, I think, for most people in their minds was housing. And in New York City, we have a right to shelter. And in any normal circumstances, we have a very large population of people in the shelter system, and many of whom are coming from Rikers Island. So in some ways, it was unavoidable for us to have people go into the shelter system. It was more about giving them the most knowledge, and ourselves the most knowledge about what they could expect if that happened. And how really it was going to be determined about who was going to what shelters and in what situations. So it was developed that people were going to be screened as they were leaving for symptoms, temperature taking, those kinds of things. People are being tested, not everybody's being tested. And so if you were symptomatic, reporting symptoms or high temperatures, any of those things, the Mayor's Office of Criminal Justice was providing transportation to a designated hotel, and you'd be able to quarantine, and also provided with a phone. To be able to communicate with people, obviously, because that actually, I would say, is the biggest barrier to, even in these circumstances, we can still get connected people to services, but not without a phone, and not without ability to communicate remotely. So I think knowing that that was maybe even the first step, wherever they happened to be going, whether it was a residence with family where they could self-quarantine or into the shelter system, if there was no ability to follow up with them through a phone, then that really any plan that you put in place could potentially fall apart quite quickly, because troubleshooting, making sure benefits are activated. If they weren't, how could we help you do that? Is your appointment, any of those things really couldn't be communicated until someone could actually get on the phone with you. So knowing that some individuals who were leaving were going to be provided that was really helpful, and did increase communication with our social workers post-release from Rikers. So they've been able to activate and do online, once again, on the computer or on your phone, be able to apply for Medicaid if they hadn't previously, apply for food stamps, apply for cash assistance, which is something previously they couldn't do online through Human Resources Administration, HRA. So a lot of things did shift, but I would say what is very different in New York is you have a lot of different bureaucracies doing a lot of different things. And it wasn't necessarily that it was some regular communication about what that would be. It was really, we learned about this, we learned about that. We're sharing internally to try to figure out how to spread the word as fast as we could, as well as getting feedback from the people that we're serving. So our attorney in charge of the special litigation unit, Corey Stoughton, who I believe was also on the webinar last week, talked about how we were getting people released quickly with our writ practice, because it really was coming to a standstill in terms of specifically clients on parole holds, because it's been so difficult to get some communication from the state agency that oversees their custody. And so it was about going to the courts to get their release, and writ practice is very fast. You get as many people together that you can get into the writ that were considered medically vulnerable, and that's where I was involved, and they're going to be out in 24 hours. And you might know that they're going to be out, or it might not be successful and they're still in custody. So you're kind of planning for both scenarios. And so many people, I think, got what is already offered within the jail system, which we have correctional health services taking care of, both medical and mental health discharge planning. We already have regular discharge planning that exists out of COVID. So they have, they're going to get 7 days of walking medication, as well as an e-script sent to a pharmacy that they can access. And so they're still getting those things, because they can't leave the jails until they're seen by a mental health professional and a doctor. But then it's also about the troubleshooting and the logistics afterwards, which is where what our social workers found themselves shifting towards. Okay, you're out. What didn't work? What's working? Is it the scenario that we thought? Is it not? Are you able, if you're in a shelter, are you able to isolate somewhere? Are there a lot of people around you who appear to be sick? Are they sharing information? And kind of getting that stuff on the ground, as well as collaborating within legal aid to get that from the other agencies who are organizing it. So it's a lot more people, obviously, to kind of coordinate that with. I don't know the exact numbers before COVID that was on Rikers, but they were reducing, but still, in the thousands of people. So and as far as people on parole violations, at the time that COVID hit, it was around 1,500 people alone and on parole violations that potentially we could be working with. And there's 4 social workers in that unit. So really trying to prioritize exactly who we can devote our resources to, assisting the attorneys, because the attorneys themselves were also trying to get involved and see what they could do, who they could call. If they could call a program to make an intake appointment, they were more than happy to do it, if we were just kind of directing them about the information that was available. And so I guess briefly, in terms of the people coming out of state prison, I would say we have way less information, to be honest. It's been a lot just being able to actually start communication with our clients, because in New York State, we were, before COVID, allowed one legal phone call for 30 minutes every month. And then everything else was written. And then, so we were relying a lot on prison visits to communicate with our clients and understand what they need upon reentry. So we weren't able to do that anymore once COVID hit, and we were able, our supervising attorneys in the Criminal Appeals Bureau were able to initiate an ability for us to communicate more by phone, which has been helpful, but at the same time, when they're also reducing staff to ensure that people are protected, the staff, then there's delays in being able to also communicate that way. So it's been really, really difficult and taken a lot of energy just to communicate, honestly, with a lot of clients who are in state prison, and, you know, getting whatever information we can, if it's from family. And then when they're released, it is just even more significantly, what can we work out now? We had a plan, we did our best to communicate the plan. Now, how is that working out, and what do we need to troubleshoot again with you? Because most of the time, everything has changed whenever they get to where they are. But so far, it's been, you know, a lot of lessons learned, I would say, and really about supporting clients in custody, about their, like, we've really shifted to really just talking to people, because we don't know when they're going to be released. They're fighting really hard for every single person, it feels like. I think Stacy and I were kind of sharing that before we started, that I think that's what's been really difficult, is there's like acknowledgement that the jail facilities and prison facilities are in and of themselves not able to social distance, and not getting recognized that we need to release as many people as quickly as possible, has been really, really frustrating, because I think we'd all welcome the problem of reentry more than the problem of not having people released in the first place.
Thank you, Rebekah. Before we move on, you're doing this out of a public defender's office.
Correct.
Does that mean that you're essentially following cases longer than you normally would if you're checking in with people, not just to establish a release plan, but then following up with them on what's working and what's not? I guess, you know, is legal aid filling just a gap there? Is that the reason that it's coming from you all? And if you're working with other people, who are the kind of key partners that you're working with through this?
Oh, yeah, I mean, I think it fills a gap in terms of maybe more about, because many of our people are still coming out on parole supervision. And so really helping them understand, additionally, what are my obligations at this point? Because they're not, you know, they don't have to go in person anymore to do, for the most part, parole reports. But at the same time, how are they communicating if they don't have a phone? How are they going to be able to make sure that they're fulfilling their mandate in that way, and troubleshooting with them? We do coordinate with lots of community providers. One of the biggest ones is a reentry case management community partner called EAC CRAN. That's something that correctional health kind of refers while they're in custody at Rikers. And then we kind of, if they're not able to connect right away, we're still involved making sure that they're making those initial connections. That's something we've done really on a case-by-case basis before, because you are correct, Malia, that most of the time the work really ends when the case ends. But for the social workers, it was still about that reentry piece. And I think it really has only increased. And really feeling that their obligation is ensuring that every person being released is connected to the best of their abilities remotely.
Great, thank you. I want to turn to Stacy, because you're in a kind of very different position. You were starting a kind of detailed reentry program right as all of this hit, focused not only on basic needs, but on recovery issues. And you founded New Beginnings. Can you tell us about these efforts and kind of where they stand in this COVID-19 closure era? You have to unmute. Stacy, you're muted.
I'm sorry. Again, I'm Stacy Borden. I am a licensed clinician. We founded New Beginners Reentry Services a little more than 4 years ago. I am formerly incarcerated. I made a promise back to the women back in the state prison that 10 years ago I would get out and try to do everything in my power to create something different. And so we've done that. We've gotten to the point where we've been able to obtain through a benefactor, a 6-bedroom Victorian home to create an atmosphere for healing, pretty much. And then this COVID-19 happened. But I want to say that we have been fighting for releases before this happened. You know, as a formerly incarcerated woman, we strongly believe, I mean, we shouldn't be incarcerated. 97% of the women that I live with, and through research shows, women have suffered from traumatic events, you know, sexual abuse, domestic violence. You know, the statistic shows, I think that our court system has not ever looked at anyone as a human being and have had prior incidences before they veered into their addiction or their traumatic experiences into the criminal justice system. So we've been fighting. We've been fighting even today through this COVID-19 crisis for compassionate and medical release, placement with housing. And I heard what you said, Kate, about, you know, placing in different shelters. State of Massachusetts has not yet released anybody, and it's been a battle. And so we're fighting. We're working with CPCS, which is the Committee for Public Counsel Services and Public Defense Officers. There are doctors on board that are for these releases, especially anyone who has had pulmonary illnesses or disorders, women who have been sentenced and been in prison for decades. We feel like they've spent that time already, and it's time for them to be released. Now, although we've been at a halt with New Beginnings Home, which we've named Kimia's House, I'm always at the point, anytime I'm at these type of panel discussions, I try to bring the voices of these women, especially Kimia Faust, Angie Jefferson, Elizabeth Hutchins, these women who have spent decades in prison that come from trauma and should not have been sentenced in the manner they have been sentenced in. And I think across the country, when we talk about women in incarceration, you know, I don't think that the world even knows what really happens in prison. You know, I think about the times that I was in prison. You know, I had to say to a correctional officer one time that, you know, the judge sentenced me, but that doesn't give you the right to punish me. And so that's what we're looking at. We're looking at a punishing system. We're fighting for women to come out. We are working across the board. When I say we, I belong to a national movement, National Council for Incarcerated and Formerly Incarcerated Women and Girls. We also belong to Families for Justice's Healing, where we fight for families' rights for releases. So we're at the standstill. We're at a standstill where the parole board, we have people who have made parole, and the parole board has not made a decision to place them and make a decision to release them. I particularly, and I want to say this, and I say this with my whole heart, that we talk about language. Language is important. We talk about there's no difference. We don't look at the difference of violent to nonviolent crimes. People commit crimes because they make mistakes, because they're coming from a place, a painful place. And so I don't try to discuss the difference of who should be released and who should not be released because of the crime, right? And so to answer that question, we're saying release our people. Make some decisions. The Supreme Court, the Supreme Judicial System made it clear in Boston, Massachusetts, that there's specific patterns that they're not going to release people due to the crimes. And we're saying, you know, they're putting in the category of Black and brown people. We know the statistics of how many Black and brown people have been charged with, they consider violent crimes. They're not budging if someone's holding a gun charge or have had an amount of drug possession that they classify as trafficking, which is they consider a violent crime. They're not budging with releasing people. And we're saying, you know, they're sitting ducks in prison. There's no social distancing. Some of the prisons in Massachusetts aren't even allowing them to have masks on. Some prisons do. How do we put those in different perspectives or different categories? So when we talk about, as a trauma specialist and as a person of color who had suffered from traumatic experiences myself and have been in the prison system, we know what it's like to be in the prison. We know what it's like to feel the disconnect from our families. They're starting to lock down the prisons today. And so, they're not even able to come out but 20 minutes a day to make a phone call or take a shower. I'm battling with the idea that, hospitals and doctors and nurses are staying put in the hospitals and they're doing their first response care. They're caretaking. And in the prison system, they look at us as just hardened criminals, and we're not human enough to even have that worth to be taken care of. And so their way of social distancing is saying, you sleep at one end of the bunk and you sleep at the other end of the bunk. And, the correctional officers are still going through their normal process of shift change. And so how else is the virus getting into these prison systems? We know that there was 3 so far incidents that the virus has already went into one of the state male facilities, and 1 death so far. Yeah. We don't know the statistics that are coming out of the women's prisons because they're not releasing them. So we're prepared. We're working 24 hours a day, all 3 teams and everybody else that comes aboard that believes in our movement to say that these people should be released. Compassionate release, medical release, parole, remove people. If they've spent 25 or more years, they've done that time. Let them come home. I want to say too that our governor have made a statement based on some statistics that the Correctional Association Department made that, those people that are incarcerated don't have any families to go home to. They're better off making friends with the mental health department. And we're like, that is so ludicrous. How dare you even make that type of statement when there's ethical responsibilities that, there's no contact in that manner. And so and they do have families. We have families, we have placements, we have respite places, we have shelters in place we have Boston Medical Facility as a big, hospital facility that has different outlets that we can place people. So we're saying free our people.
Yeah. Stacey, I want to build on that point, because a lot of the times the first question is, how can you release people with no place to go? And I think it does get overlooked that many, many people actually have a place to go. And the housing planning that people are doing and having to do is a smaller part of the population than most people might think. Right. So do you really have a sense, actually that's sort of a good question for the county folks or for Rebekah, like what percentage of the people being released you're having to identify housing? And then I'd like to use this as a transition to talk about the different types of housing and where you're finding it.
In Pima County, we had, of the 50 or so individuals that were released from custody in those surge releases, and I don't want to diminish the work that the public defender's office is doing in these one-offs where they individually file motions, but among our surge releases, we had about probably 20% or so had identified as not having housing. And so when we got the list of names from the stipulated names, we were able to work with our pretrial program to communicate with those individuals in advance of who had a place to go. It gave pretrial a little bit of time to verify that they did have that housing resource available to them. And then for the individuals who didn't have housing, it gave us, not a lot of time, but usually about a day or so to come up with bed placement for them after they did get released.
Rebekah?
So I would hesitate to kind of say, I know many of our people who are in parole violations do utilize the shelter system. I think what we have kind of stepped back and really thought about more is that we knew this all along, that we have a lot of people who have places to live, within the 5 boroughs of New York City, but for parole and their approval process. So parole won't allow them to live in certain family homes and certain friends' homes for various reasons. I feel some potentially could be justified, but I don't think many are. And so you have places where people do have very safe place, like living scenarios, but parole won't allow them to go there. So what we've really kind of taken a step back and said, and asked clients more often, do you have a place? If parole's not approving it, can we still talk to your family and make sure that you can go there? And that way, once you get out, if you decide to go there and report to parole that this is where you feel safer at because of the pandemic, how can we be involved with that advocacy? And really monitoring how much their supervisory agents are enforcing these technical rules versus like being more concerned about new arrests in the community. So that's what we've tried to help maybe identify more and ensure that we'll be there as support if they feel like they're more comfortable, and we want to advocate with parole after release to ensure that they can stay out of the shelter system.
Can I just touch on that, Malia? I want to say that we have less than probably 200 women in the state prison. And in Boston, the county jail is holding less than 300. And so are we prepared? We deal with families every Tuesday that come to participatory defense meetings. And so to say that there's no placement or the families aren't, or they're estranged, as the governor said, from the families, we know that's not true. And again, as a reentry specialist, we have been able to find placements in our communities with, you know, people offering their homes and renting out their apartments, and we're prepared to pay rent for people, especially gentlemen that are guys that have made parole and are still waiting to be released. The percentage of women, and I have to say this, I have to say that the state of Massachusetts is trying to spend $50 million to build a new prison for women. And we're saying, for what reason? With that $50 million at this point of COVID-19, we can use that in the community. We can shift that money and divest it right into, invest it right into our communities and have these safe houses for them to be released. Why leave them in there to catch a virus that could potentially kill them? And so we're saying we're prepared. We're prepared for their releases. And our families, we're working with them every day. They're calling us. We're keeping them updated. We're Zooming people in the prison system and let them know how their families are waiting for their release. And we're prepared for that. So I just wanted to put that out there.
Thank you. That's great. Rebekah, I want to turn to you only because I will speak for Wendy and Kate. They have not actually confronted positive tests in their jails yet. New York has, and that creates sort of categories of people who are you have to find placements for. People who, you know, screen as maybe potentially exposed because someone on their block or a couple people on their block have now tested positive. You also have people who have actually tested positive who may be in these categories for release. And then you have kind of the other group of people who the only way, you know, the only kind of exposure they come out with was they were in Rikers, right? So can you talk to us about those different groups and how planning for that, whether it's, you know, 20%, the small percent that don't have a place to go, what is the kind of places that you're sending them? How are you able to get them to a place that allows for, whether it's appropriate just social distancing, actual self-quarantine, or medical care and services for those who are positive? And in that, can you kind of maybe highlight for us how temporary these placements are?
So for people that I know I've helped kind of facilitate releases for who are positive, it's been varying levels of symptoms. So some have been in the quarantine units at Rikers and have needed, you know, a higher level of care. And for those, it was a question of what are people being released to? Because I think the correctional health services and the doctors there acknowledge that they would never want to be a barrier to someone having their freedom. And so it's really about how can we balance all of these things and ensure that the family, because in this particular case, I'm thinking about is the family ready for this? What do they need? And just having those conversations, because as Stacey was saying, assuming that people don't have places to go, I think is one of the worst things we could do. Because this person, he was a young person, and he had a place that he could go. And he had lived there previously, so we knew parole had approved it previously. And so it was just talking to the family and really working out, okay, he has a room, this is the plan, we have other people who can come help, the primary caretaker, because she herself was also kind of vulnerable because of just demographics, age and such. So it was really kind of a fluid conversation from the doctors with the family and the person who was being released to understand what they would need and if that was able to happen. If it wasn't, it wouldn't have been a barrier to release. It would have just changed the reentry plan, and it might have taken a little bit of working out logistics. So for those who have tested positive and are asymptomatic, those are still individuals that are upon release given the option, if they don't have a place to go, then they can go to the shelter, or I'm sorry, to the hotels that the city is transporting them to quarantine for 14 days. They're not, we know that they're not required to stay there. It's not a matter of like, you must quarantine and we're making you because you're coming from jail, because I think we all would feel uncomfortable with that too, kind of locking people in when no one else is being locked in that kind of way. And so they're allowed to leave, but once they leave, they can't return to those shelters. So it is those 14 days of ensuring that if people are testing positive and are able to manage on their own in terms of if they would normally kind of be sent home from their doctor to manage the symptoms, and they're able to do that, and ensuring that they have what they need to care for themselves at the hotel, including a phone and any, like, I guess, medications that they would need on hand. So, and then those individuals who are just kind of exposed because they're at Rikers, and we know basically the assumption is that all of New York City is exposed. That's kind of what the message has been, to assume that that's happened for you. People are definitely, if they're going into the shelter, there's screenings happening along the way as long as they're leaving, screenings at their intake shelters, which are separate for men and for women in New York City. And then there's an ability for either, if people need to isolate within the shelter that they're in, or if there isn't, then they can be transferred to another shelter. There's a very large system of shelters in New York City. So they've set up, DHS, the Department of Homeland Services, have worked on doing that to ensure that they're minimizing risk. It's not, ensuring that anybody isn't going to be exposed or that's not going to happen, but minimizing, I think, the best that we can, knowing that lots of people coming out of Rikers could develop symptoms or are positive and asymptomatic. And so it's all about communication, really, I think, and knowing what people already have, building on those resources, and then if they don't, what we can provide for them.
So you mentioned the hotels. Is that a max 14 days after their 14-day period, or do they have to move on? How long does that housing last?
I don't know the exact, that's my understanding. Those are the couple of people that we've had released to them have left at that time. I think one person actually left earlier than that because they felt okay and didn't want to quarantine at the hotel any longer. So I don't know if there's any, we don't know at this point if there's any long-term plans other than entering back into the shelter system and going through regular process of finding housing, more permanent housing, which I imagine is, also tied up and limited in terms of what they can move things along at this time.
Right. Wendy, Kate, have you all heard in your county, has the COVID-19 crisis created new housing opportunities? And if so, are they kind of short-term, long-term? We're seeing across the country in I think it was San Francisco that designated a big sports stadium for additional shelter during this, in part so that people could get there and get access to services, and they could try and transition them to housing and at least get them screened and so forth during this time. But I'm wondering if it's actually created new and different housing opportunities.
Well, I'll maybe start this and Kate can chime in. As she mentioned, at least with respect to this surge release that she was referring to before, we had many fewer folks who identified as homeless. So we were able to, through the, as we mentioned before, through the contacts that we already had and our housing programs that we already had and in those connections, we're able to place those people in safe and stable housing. One of our programs, our Housing First program, has a series of different types of housing where there's bridge housing and then permanent and safe supportive housing. And in the bridge housing, up until recently, we were placing maybe 2 people in a room. A few weeks ago, we stopped that so that we could ensure that folks were self-isolating as they needed to. I'll let Kate answer more about whether or not I've heard that some people were suggesting hotels, but I don't know that we've, at least for our released inmates, we've needed that.
That's right, Wendy. Fortunately, we've been able to work specifically for our justice population. We have again the benefit of already having these strong relationships, and so when this issue came up, we were able to work with our existing partners. But just from participating in our daily shelter, I've been able to keep abreast on just what's happening on a larger community level, and there is active work being done right now to be able to rent out some of the hotels and motels that are in our community that are now being unutilized. We haven't needed, because we don't, in Arizona, our parole population is a division of our Department of Corrections. And so I'm not sure if they are looking and exploring those options, but as far as our jail population, that hasn't been needed. I'm also aware that our University of Arizona dormitory housing, they have been actually, for the residents who have left the dorms, they have cleaned out some of the apartment complexes that are near our University Medical Center to make available housing for our medical professionals who are self-quarantining away from their family. They have been making available some dormitory housing, and I understand that's being explored for a potentially our shelter population, but also a field hospital type situation. And so there's lots of those conversations happening right now where, everybody across the board, that's very much our community culture, is that people come up and say, I've got dormitories, I've got hotels, I've got, I've even seen people who have our Airbnbs. We have a community, a Tucson COVID-19 page, and people have been coming online and saying, I've got an Airbnb that I can make available to people who need to quarantine themselves. So it's really, in a very dark and challenging times, it's really heartwarming to see our community coming together like this.
That's wonderful. I want to get to some of the crucial aspects of reentry other than housing. And I want to actually start with one of the things you said, which was the probation and parole requirements, right? I can't tell you how many times I've tried to emphasize with someone, when you're released, you have to be at probation tomorrow morning at 8 o'clock. Otherwise, a warrant may issue, right? So how is that working now? How is that process of essentially getting someone into supervision? How is supervision checking in? Usually that then results in an assessment of needs and kind of a plan. Is that still taking place, or is that being pushed out, that kind of assessment of other needs that usually comes through the probation department?
In Pima County, I'm aware that both our probation and our pretrial departments have moved to telephonic appearances. And so they are trying to maintain a lot of the, most of our jail releases have come out under pretrial supervision. We have had some folks on their own recognizance, but this was part of our compromise between the public defender's office and the prosecutor's office, that individuals that they typically wouldn't have released, they compromise and put those people on pretrial supervision. And so pretrial is managing a lot of this increased caseload, not only because of social distancing, but just helps to manage a lot more people who are on community supervision. So they're doing it primarily telephonically at this point, as is probation as well.
Rebecca, Stacy, does one of you want to tackle what's happening in your jurisdictions?
I think that, well, for one, again, parole has not made a decision on releasing anybody. We do know that since Massachusetts or Boston area has been on a stay-at-home basis and now at 9 o'clock curfew, some of our women that are on parole, especially federal parole is still requesting them to either show up at the offices or they're making home visits. And so, I mean, they can create something, you know, I mean, people are home. And so why put them at risk? So, but can I say this? I wanted to say about the language. I'm kind of feeling like I need to, as a formerly incarcerated woman, we choose language different. We don't really like to use the term, we don't use the term inmates. We're not inmates, we're people. We're not addicts and junkies and felons, we're people. So if we could just be kind of mindful about using that language, I'd really appreciate that. Thank you.
Rebecca, did you want to?
Yeah, thank you, Stacey. I also appreciate the kind of plug about language, because I think it is important and really speaks, I think, to what the information that we've gotten in terms of parole supervision has been. Everybody go remote. I don't really know what kind of assessments have been done in terms of those individuals who don't have the ability to do that, and where as people are being released from prison, kind of getting them to be able to do that in time to do their arrival report within 24 hours is a bit scary. So it's about us really being in contact and understanding what the current obligations are, and if problems arise, we're there to advocate. But we did note, and I think that there might be potentially special exceptions, unfortunately, for those individuals that they deem high risk, just purely based on things of their crime, which I think speaks again to what are we really talking about when we're trying to keep everybody safe. So they might still be, and this is kind of where we're trying to just get information as best we can, requiring people who are on the sex offender registry to come in person, and as well as those on specialty caseloads, those individuals who are on mental health caseloads. And so why those in particular, when maybe more video conferences or more phone calls would just be more appropriate, they're required to kind of put themselves at risk more. When we have a lot of parole officers who've tested positive already, we know that, and there are many who have been hospitalized. So it's not, very, and if you're having anybody come into the office prior to when they did this, which was, I think it was March 20th, they were still like parole waiting rooms full of like 40 some people, right? And so it was not social distancing at that point for sure, for our individuals who we're advocating for, and who are maybe potentially going back to a shelter where it's just difficult for them to socially distance as well. So there's definitely a differentiation between who they're still kind of thinking they need to see in person. But so far we've just been advising clients the best that they can. If you have access, call. If you get someone to tell you that you don't have to go in, then don't go in. But we also don't want to jeopardize, because we know in New York, they're still violating people on technical violations only. So those individuals who have had no police contact or no new criminal cases, they're still putting back in Rikers, and really putting so many people more at risk, whether that person is already testing positive from the community and bringing it more into the jail, or they're being exposed in the jail. So the idea of like looking at parole supervision through a public health perspective, it hasn't kind of gotten into New York in a place that so desperately needs it, because we've had our first person pass away, and he was only at Rikers because he was on a parole violation, and that's it. And it was technical. And so that was really, really a hard thing for us we've been fighting and scrambling so much to get as many people out as quickly as possible, regardless of what they're on supervision for. And, I think we knew it was coming, but it didn't make it any less painful that this was happening and that he had to die in custody on something maybe as minor as a missed curfew, right? So I think that would really be the take-home message, I think, in minimizing anybody that has to really come in contact with any sort of supervisory agents, I think is really essential in the community.
Are you hearing about, and maybe Stacey, this is a good question for you, like creative ways to provide appropriate support for people who are coming out? We've spent a lot of time talking about housing. We haven't talked about food beyond the availability now online to apply for benefits. But you know, people who are released need connection. They need support, and so things like whether that is about just general connection, like groups to talk about the process, or whether you're talking more specifically about counseling, or for whether it's trauma or substance abuse. How are we making sure that those things continue to happen when you're releasing people to potentially 14-day isolations and so forth?
So one of the things we're doing, Saturday mornings, we have a trauma-informed care group, and there's about 20 of us. It's starting to build more and more. We start at 10 o'clock to 12. It's phenomenal. And so Wednesday night, we meet formerly incarcerated women. We meet from 7 to 9. That's phenomenal. Tuesday nights, we meet with the families to give them the additional support as participatory defense organizers. Still continuing to fight to get our people released. So, you know, one of the other things that I do as a clinician, we support the families for when they're going to be released. We need to make sure that some of the mothers, brothers, sisters, aunts, whoever our family member is going back to their families to have that type of connection. I love that question, Malia, because it's important for families to know that if you've spent 10, 20, 30, even one day, but 25, 30 years of incarceration, you know, our families often want to smother and want to be around and love us up, right? And so it's hard for an individual who have been in a 5x8 cell for decades to receive that. And so we're working hard to prepare families for releases, and so they can have a good connection and have an understanding of what happens to an individual who have been away and really don't know how to receive that type of love and understand how to give them that type of support. So we're working around the clock. We're here 24 hours. So we also have, I was trying to link, we also have a generated massive resource list that we put on an Excel sheet for some of our members to come out to. We put it on a national movement so we can keep it growing nationally. So I can send that to you, Malia, if you can find a way to get it back out to participants. There's like 400 people that might want some resources. I think it's good so we could have that available for when people come out. And, you know, Rebekah, everybody can add on to their resources to this list. I think it's important for our individuals to have that resource. And I'll email that to you as soon as we're done here in case somebody want to reach back out and look into it.
How have your meetings been adapted to the current climate? Are you still meeting in person? Are you doing it more online?
We're doing Zoom. We're doing Zoom, and it's hard. I mean, I haven't been able to really navigate it, but we figured it out. I mean, it might be a 10-minute or 7-minute process for somebody to click on, but they show up. They look forward to it, and you know, it's all about really trying to. What are the things that you can be creative in doing while we're locked in? Right. And so some of the parts that New Beginners Reentry Services is really about is really targeting the trauma that some of us don't even know that we've developed, or some of the condition that we've been living with for years. And so we do it in a form of art. We do it in a form of books, and we do different quotes and readings and song, music, art. We know heals. And so that's what we do on Saturday mornings. Everybody looks forward to it, and it's growing. So if anybody wants to join us, just let us know, and you're welcome to come on and, you know, participate. It's a good way to release the isolated feelings or the fears of contracting this disease, or even really trying to figure out what happens to us if we could really be in tune with our own selves and begin healing. Then we could kind of be part of that transformative justice part of helping the ones that are coming home heal too. So yeah, we do it Zoom Tuesdays from 6 to 8, Wednesdays 7 for formerly incarcerated women, 7 to 9, and Saturdays trauma-informed care from 10 to 12.
Fantastic. Maybe one of the small benefits is smaller programs get wider reach once they've been forced to go online. Wendy, did you have something to say about
Yeah, I
access?
just wanted to make a quick comment. When you were talking about food, I saw a news story, local news story from yesterday about the jail providing sandwiches. So inmates and other people at the jail are making sandwiches to be sent out to soup kitchens around the city. So, you know, maybe not the most delicious food, but at least they're doing something with the food that is in the jail that can be used for other purposes. So, you know, it was an interesting story because frankly, I would never have thought of that. And I think it's an indication of how some people are really thinking outside the box in terms of trying to keep people fed and healthy.
Yeah. Rebekah, any idea how food delivery is working for, like, for example, quarantine people in hotels?
That's a good question. Well, I mean, you know, New York is still definitely a order out community, but I do know that most of what New York has done specifically is all of the food that they were giving to children in the New York City schools, that once the schools close, they've expanded to everybody. And so anybody can come during certain periods of time to any pickup location. No ID required, literally nothing. Like, you can just come, pick up the food, and you can go. The hotels, I do know they provide the food on site. They have, you know, it's nothing like expensive, but it's definitely people that it's definitely enough that we've heard what people have told us that they're getting, because we've asked about that for sure. And so, in addition, what I wanted to also speak about was the connection piece too. I think one of my social workers kind of put it in a way that makes sense is, for me, is that she's like kind of talked to people, especially coming home from prison, that this may not be the homecoming you expected. Certainly the idea of like going and being around family when you wanted to be is going to be a lot harder, and we're going to help you figure that out. And for one person I'm thinking of specifically, who was released when we were able to get her resentenced under our new Domestic Violence Survivors Justice Act, all of her basic needs were like really attended to. She was able to get connected to great services through community agencies with our social worker. And really at the end of it, she was just craving that, because she's someone who really likes to stay busy. She was looking forward to going to school. She was looking forward to getting a job. And I think those are the pieces right now where, since basic needs are really okay for her, it's not ideal, but it's okay, then that stuff that keeps people busy is really what's lacking. And it's been hard to have a little bit more of foresight down the road, because that feels, you know, when you're kind of just trying to feed people and make sure they're safe, it feels a little like future oriented and so distant, when that's been something we've wanted to keep including for these specific reasons, to help people stay connected, especially coming home from prison when they've been disconnected for so long. So I'm glad you brought that piece up about connection, because it's something we're really thinking about how we can do better.
You mentioned one other critical point, which is employment. You know, that's a difficult thing to talk about after 10 million Americans have filed for unemployment in the last 2 weeks, but it is a critical aspect of reentry. And I think something very difficult to do now. Does anyone have some ideas about what it, you know, and often it's a condition of probation that you spend a certain amount of time looking for employment. I don't know how realistic I find that, but I also think that we're releasing people with almost no money, whether it's about employment, whether it's about access to some of the supplemental programs that acknowledge how many people are out of work right now, whether the CARES Act or something else. Do you all have any ideas on how the employment or financial aspect of reentry is going at this moment?
I mentioned our Pima County One Stop program there, and you know, this is all very fluid, and people are kind of scrambling to figure things. Building the plane as we fly it is what we like to say here. But we do have a lot of individuals who have been released who are, especially for those individuals who have identified as being homeless or houseless. We try to make sure that when we are providing housing that we've secured enough weeks housing and actually working on expanding from 3 weeks to 2 months so that individuals, as they are looking for employment, don't have that hanging over their head, knowing that they have to look for something else in a couple of weeks. And so trying to be realistic about what that employment seeking looks like right now. But I think that's one of the biggest challenges we've had in our state right now is a lot of misinformation and miscommunication among those benefits providers like DES and our Medicaid system, is that the governor put out a lot of direction as far as releasing some restrictions on who's able to get like SNAP benefits. And a lot of that information is not trickled down to the staff who are on the front line. And so we're sending our participants, our clients into apply for benefits, and then they're being told by somebody. And fortunately, we work with a lot of housing providers who provide those wraparound resources who will then go back and advocate with their client to these governmental entities. No, we need to talk to a supervisor. We need to have a review of their eligibility because the governor put out this information saying this person is now eligible for. And so we're trying to advocate to our governmental entities for better communication with those frontline staff. But I think that's certainly a challenge. And, you know, and the people that do have these advocates that they're working with in our housing community are going to have support and assistance. We have a Housing First program just yesterday where our Housing First provider was talking about, can we provide supplemental nutrition while we wait to try and iron some of the stuff out? I don't know if you want to talk about that a little bit more, Wendy.
Wendy, I think you unmuted and then muted yourself. Try again.
So our Housing First program is funded by Pima County general funds, and the city of Tucson has supplied 150 housing vouchers. As a matter of fact, somebody on the Q&A had asked about how long it took for us to house people in Housing First, and I can certainly answer that by looking at our data. But the person who asked about it said it took as much as 6 months, wherever that person was in Ohio, and I can assure you it does not take 6 months or even 6 weeks in Pima County. But nevertheless, what our Housing First partners have found is that given the shutdown of a lot of soup kitchens and other places where food may be obtained, they need to provide, access some of our funds to provide some of hygienic products and just food basics. And we've been able to look at our contract and see that it can allow for that. It's not that expensive, and certainly is a reasonable thing to do under the circumstances. So we've been able to do some of that. But as Kate had mentioned, a lot of our Housing First applicants or clients have had run into problems getting their benefits. And our governor, our Arizona Governor, Doug Ducey, has issued some waivers in terms of requirements for getting SNAP benefits and other benefits, but getting this information down to the folks who are seeing the people face to face or over the phone has been somewhat difficult. So we're actively searching for either an ombudsman or somebody from maybe the governor's office who can help us smooth that path because this is not the time for people to, face going without their benefits when they deserve them, they're entitled to them, and just the messages aren't filtering down to the right people all the time.
Right, and you have one line, you said, for kind of all social services, like a coordinated entity. That was something that I think was trying to take off nationwide, whether it was the 211 system or other options. I was wondering if some small upside of this is that something like that will take off on a more widespread basis, just to try and coordinate. Is that getting more traffic? Do you know if like your one line is becoming a greater used resource at this moment?
Malia, are you talking about our one-stop connection?
Yes.
Something
Yeah.
different, at least here in Pima County. I am not familiar with the 211 program. I don't know if Kate is, but what Kate was referring to, the county-run program that even in non-pandemic times works to try to place people in employment, et cetera. But I think you ask a better, bigger question, and that is whether or not the things that we've seen implemented here in Pima County and maybe elsewhere, it sounds a little tougher in Massachusetts and New York, but whether or not these implementations are going to take root. And even after we're out of this horrible time, dark time for our country and our world, will these protocols stay in place? And I certainly hope they will, because one other article I saw in our local news was our sheriff, Mark Napier, stating that despite the fact that we've had some of these releases, there's been no spike in crime. There hasn't been a marked increase in domestic violence, which was something that people are worried about. You're in this terrible situation where people are isolated and stuck in the house, and is that going to make that kind of crime go up? And so far, fingers crossed, we haven't seen any of that. But at the same time, both our police chief, Chris Magnus of the Tucson Police Department, and our sheriff have made a concerted effort to try to show more assistance, more appearance, like at grocery stores. There have been some concerns about elderly people maybe being targeted at grocery stores, because some of our grocery stores have set aside a time period where only elderly people could go and get their groceries, and people have it has sparked some concern. So our law enforcement, I think, is being really resilient in terms of trying to accommodate and work harder towards recognizing the different types of things that are going on due to the pandemic.
So we are quickly reaching the end of our time, and I have to tell you that there are like 40 open questions that people would love us to address. Everything from special circumstances for those with mental health issues and sex offenders to transitional housing. We're not going to be able to get to it, but I would like to give every single one of our panelists an opportunity to, address the question of their choice, or just give some advice to other jurisdictions about how best to proceed in this moment. Maybe jurisdictions that aren't quite as well organized as Pima. Wendy, do you want to start us off?
Sorry, I've been muting myself and unmuting. It's been a little crazy. I think the thing that I want to emphasize, and one of the questions I saw was, how is your prosecutor's office doing with this in terms of, like these surge releases and everything? And I'll tell you, our prosecutor's office has been at the forefront of leading these new protocols. Our elected County Attorney Barbara Lawal and our Chief Deputy, who was your guest last week, Amelia Kramer, have been really working very hard towards this goal. A couple of weeks ago, Kate, you might remember the exact date, but there was a weekend before the first of these releases, we had prosecutors and public defenders working round the clock, and I'm serious, round the clock, to go through lists of detainees in the Pima County Jail to see who would be among the best to release safely. So, you know, we've done that. Our folks at the jail have been working tirelessly, and you know, they can't have face-to-face communication, so that, you know, it's a very difficult time for them to try to do these interviews for these people who are being released, giving them the information about how to keep safe during the virus, et cetera. But it has seriously been one of those times when you couldn't be more proud of your community in terms of people working together, setting aside differences between prosecutors and public defenders. I mean, that's historically, you know, a sort of a source of conflict. But that's out the window when these people have decided that we're working together. And we've got people seriously who are working around the clock, and I couldn't be more proud of this community.
Evenings, weekends. It's been, the public defender's office had a whole staff of attorneys working all weekend long to review hundreds of cases of people who are currently in custody. And we do, you know, speak very Pollyanna-ish about what's happening here. We are very proud of our community. And I think what's important to know is that this is not without conflict. I think people see us all getting along and working cooperatively, and they think, well, I'll never be able to get along with my blank entity the way that they are. And this doesn't come from everybody always agreeing with one another. This comes from people being able to communicate with one another, and not only communicate what our needs and wants and our vision is, but also being able to listen to our other entities that are participating. Because sometimes, you know, one agency will have a very different priority than another one, and we are able to compromise when we listen to one another and respect the lanes that people are in. The public defender's office has a very different lane than the prosecutor's office, and we've achieved success by the two of them really being able to respect each other's roles and boundaries. And I think the other key to success here, in addition to turning into the skid when it comes to conflict, is also being comfortable with uncertainty, not letting perfect be the enemy of good. That we are stumbling. We have there's probably dozens of things the last couple of weeks that I would have tweaked or handled differently, but that we assume people are having good intentions, and that we are all trying our best in a very uncertain time, and really being comfortable with that uncertainty, that we're just going to have to continue to tweak and adjust and be responsive and adaptive.
Thank you guys so much. Stacy, final recommendations?
Yeah, I felt the same way, Wendy. I saw an old friend, Adam Foss, former DA, asked that question, and I couldn't wait to respond. I don't know how many people would agree with me, but we have a good progressive district attorney in Suffolk County, and she has, Rachel Rollins, she has signed on with 9 other district attorneys to release some people, along with massive amounts of doctors. And so we're grateful for that. Not to say that she has a push, a resistance from, of course, the police association, correctional association, and nobody's budging. But we're rooting for her. She has came in and created a conviction integrity unit, which we're really grateful for. They're reviewing thousands of cases, like Kate said, that should have been released decades ago. And so our CPCS and public defense attorneys are working tirelessly to make things happen. And we think and hope that this is the change for Massachusetts, that we could really kind of dismantle. I mean, we're really serious. We're ending mass incarceration of women and girls, and the system just needs to be dismantled. I need to say that. And I just want to go back one more time, because I have to get off here. And I really say that language is vital. The more that we use this language against us as formerly incarcerated and incarcerated people, as providers and as people who are fighting the fight of reentry, we can't look at people as that. We need to look at people as people. We made mistakes and we've been punished for those mistakes. And when we are released, we need to be treated as people. And so I really implore you to just kind of think about the language before we say inmate, before we say junkie, before we say any of those derogatory terms that we've been labeled as. Think of us as human beings that made a mistake, and we should be free. And I just wanted to say that. So I have to sign off and get on to another webinar training. This has been great. I really appreciate it. Thank you for inviting me in. And I'm looking forward to some responses after. I did email you, Malia, the resource guide because somebody asked for it. So thank you again. I'm going to sign off, and everybody stay safe.
Bye, Stacy. Thank you.
Stacy, thank you.
Rebekah, I'll give you the last word.
Thanks. I think, you know, I think my 2 lessons learned so far is really know the communication with your individuals that you are helping to reenter, their capacities, how you can get in touch with them. Think really outside of the box the best way you can. And if there is anything financially, like concretely you can put in place to ensure communication after release is 100% essential. And then I think a bigger take home for me is these aren't normal circumstances. So don't ask for normal things. Ask for everything, like normal ideas of like, oh, this person has a bad charge and a high bail. Doesn't matter. Like go ask for big things this time and see what people are willing to risk. There's people out there willing to risk bigger things right now and take chances because it is about survival. It is about life or death. When you're talking about jails, it is about life or death. And so if you have that kind of perspective, when you're asking for things, you might be surprised about what your answer is. It might not always be yes, but you might get something you didn't expect. So really ask for the moon and see what you can get.
Wonderful. That's a great way to end, I think, and a very important point. I want to thank our panelists so very much. What you are doing is critical work, and we are tremendously grateful for your willingness to take time out of your schedule and share your experiences. I want to thank our co-sponsors, CRSJ, particularly. Without them and their staff work, these webinars would not be possible. I want to say one more time that this would not be possible without the American Bar Association. And so I really hope, first of all, I'd like to thank the ABA members who are on. I'd like you to think about joining. I have a slide which I managed to pull up, which is amazing. And just as a final reminder, we'll be doing more of these. I think our next one is actually going to be lessons from past disasters, featuring a whole bunch of people who were in the advocacy community during Katrina, because some of this is not that new. We feel like it's brand new, but some of it is not new. So best of luck in your work. Stay safe, everybody, and we hope to see you again next time.
Thank you, everyone.